Hi, my name is Karen. I am at least 18 years of age and I'm okay with being videotaped for this project. Okay, so here is my MAR. We are giving medications to an Elaine Smith. She was born on September 16th of 1998. So we are going to go ahead and perform hand hygiene. She has no known allergies. That's on her MAR. And the medications that she is taking, there is no discrepancies between the medications and any of the other medications. So there's no contraindications. We are going to be giving digoxin of 125 micrograms by mouth daily. So we're giving that at 8 a.m. We're also giving her Humulin, which is insulin, subcutaneously. We give that 4 times a day. We're also giving that at 8 a.m. We are going to be giving her glucose. We're going to be giving her 3 units of insulin because her glucose levels is 256. So because her blood sugar levels are between 251 and 300, it is ordered to go ahead and give her 3 units of insulin. So I'm going to go ahead and grab her medications, and we are using. This is her insulin, since we do not have any insulin vials. And then we have here her digoxin. By looking at both, we can see that neither of them, the expiration dates, neither of them are expired. Her digoxin is at 125 microgram tablet, and that is here. So we're going to go ahead and put that in the cup for her to take later. And then we're going to go ahead and draw up her insulin. And, well, first we're going to go ahead and make sure that her dosage is correct, which it is. She should be getting 3 units of insulin. We should then also make sure that the nurse is also, we have another nurse verify that the calculations are correct and that she's getting the correct amount of insulin. And same goes with her digoxin as well, to make sure that she's getting the correct dosage compared to her weight and everything else. So from there, we're then going to go ahead and we're going to open an alcohol swab. We're going to clean the vial of the insulin. And as that is drying, we're going to take a syringe, and it would actually be an insulin syringe. We have a 3 milliliter syringe here, but it would be an insulin syringe. We would go ahead and open that up, and we would grab 3 units of air. And then from there, we would go ahead and, after the top part of the vial is dry, we would go ahead and inject the air into the vial. Then we would turn it upside down and go ahead and get the insulin into the syringe. And then from there, we would go ahead and take a one-handed swoop to make sure that the insulin cap is on, and then make sure that it is capped properly. We would then also make sure to have a second nurse confirm that it is at least 3 vials of insulin, or 3 units of insulin, so that we can make sure that that the correct amount is getting given to the patient. We would again want to make sure that we are giving the correct dosage to the correct patient at the correct time and the correct medication. So again, we would make sure that we have the insulin, the Humulin. That we are giving to the patient at the correct dosage, and that we are giving it to Elaine Smith. We will then also, again, make sure that we are taking digoxin at the correct dosage and giving it to Elaine Smith, so that we are making sure that everything is correct with that. That the digoxin is given by mouth, and that the insulin is given subcutaneously. From there, we will go ahead and get all of our supplies, make sure that nothing is opened, to be able to go ahead and go into the patient's room to be able to give her medications. So then from here, we'll go ahead and say knock, knock, knock.
Hi.
And perform hand hygiene. Hi. My name is Kayla. I'm going to be your nurse today.
Hello.
Can I please get, can I see your wrist? Can I please get your name and date of birth?
Sure. It's Elaine Smith, 1948.
Awesome, thank you. All of that information is correct. So I'm here today to do to give you a couple medications, your morning meds. We're giving you digoxin, which is used for heart failure, that we're using for heart failure, for your heart failure, and then we're also giving you insulin that we're using for your diabetes. The couple things that we need to make sure that we look out for, just so you know, if you have any symptoms of feeling irritable, any nausea, vomiting, excess sweating, blurry vision, things like that, those are some side effects between the digoxin and the insulin, so we want to make sure that everything is going okay. So please let us know if you have any of those feelings so we can go ahead and make sure that everything is okay with you and give medications if needed. Do you have any questions about the medications?
No.
Awesome. Is it okay that we give the medications to you?
Yep.
Awesome. So first I'm going to have to do a assessment really fast just to make sure that everything is okay and that the medications you're able to get. So I'm just going to go ahead and from here I would go ahead and check her apical pulse and check it for a full minute to make sure that she's not bradycardic. Anything less, we would decide that we were going to hold the medications. I would also then check for any edema in her peripherals, so any pitting edema in her legs or any edema in general. And then I would also go ahead and check her lung sounds as well for any crackles or things like that. And then we would also take her other vital signs, so her temperature, her blood pressure, her O2 levels, any pain, and her respirations as well. So, just a couple of quick questions beforehand. Do you have any allergies?
No.
Are you taking any medications that we don't know about?
No.
Awesome. How is your swallowing? Are you coughing at all after swallowing? Or after drinking or taking any sips of anything or after eating?
No, not that I noticed.
Perfect. Awesome. So we're gonna go ahead and we're gonna give 2 different medications. The first one being your insulin. So that can go in a couple different places. Sometimes it's either done behind the arm, kind of in the back of the arm, or a lot of the times it's given in the stomach. Do you have a preference?
No.
Perfect. I'll go ahead and do the stomach just so that we have enough area. Let me go ahead and put on some clean gloves and then we'll go ahead and go from there.
Okay.
So then I would go ahead and don clean gloves and make sure that everything is good. I would go ahead and take an alcohol swab. Go ahead and open that. From here, I would also make sure that she is in a comfortable position. We would elevate the bed to make sure that it is high enough so we're not straining anything. If you needed to put down a rail, you can go ahead and do that as well. So then from here, we'll go ahead and about 1 inch from her belly button, we're going to go ahead in a circular motion and clean about a 2-inch area to make sure that everything is clean. And then we're going to go ahead and grab the insulin. And we are going to, once the area is dry, go ahead and squeeze. We're going to go ahead and inject the insulin. It's going to go in about a 45 to a 90 degree angle. So we would inject and then lift up and stabilize the needle and then go ahead and we would inject the insulin. And then from there, we would go ahead and lift in the same direction to make sure that everything is okay. We would also put a gauze to put pressure to make sure of any bleeding. We would then also go ahead and cap the insulin with its safety cap and discard it in the sharps container. And then we would, once that is all done, we would go ahead and put an ACE or a bandage on there for any excess bleedings or things like that would happen. We would then go ahead and take off our gloves and then perform again hand hygiene. And then again, making sure that the bed is lifted, the head of the bed, we'll go ahead and make sure that it is lifted at least at a 30 to 45 degree angle so that she is sitting up to be able to take her digoxin medication. So we will go right here. Here is a cup of water for you to be able to help with the medication. You would then go ahead and open the digoxin and put it in here. Here is the medications if you want to go ahead and take that when you're ready. Thank you very much. You would then go ahead and document to say that her digoxin has been given, that she has swallowed it and has taken the medications. From there, we would then go ahead and make sure that we put her head back to a comfortable level. We would make sure that the bed is knocked all the way down so that there's it's at its lowest level. Put up any railings that might be needed to be up, and then again perform hand hygiene to make sure that cleanliness has happened. Now, Miss Smith, there's nothing else that I do have to give you at this moment. I just want to make sure that here is your call light in case you do need anything. Do you have any questions for me, or is there anything else that I can get you?
No, it's okay.
Awesome. Thank you very much. If you do need anything or do have any of the symptoms that we had talked about, the dizziness, the nausea, the blurred vision, any of that kind of stuff, please make sure to let me know so we can go ahead and try to get that all situated for you right away.
Okay.
Once done with the patient, we would go ahead and thank them for make sure to thank them for letting them give you their medications, and then you would go ahead and document. You would document the 5 rights: that it was the right patient, the right time, the right drug, the right route, and the right dose of the medication. From there, we would also make sure to document any of the outcomes that they had, if they had any negative effects or if it was or any kind of reactions. We would also assess or document the assessments that were made for any of the data collection. So we would document their vital signs, their heart rate, any edema, their lung sounds, their respirations, all of that. We would make sure to document that we did do teaching, and if they were able to understand teaching, as well as document if the medications we decided to withhold the medication because of things like bradycardia or anything else, as well as making sure to document if they refuse to take any medications, and then from there we would go ahead and initial and sign that we did all of that. Thank you.